February is American Heart Month. It's a time we focus on raising awareness about cardiovascular disease and how it can overall affect our health and the things that we can do to lower the risk for cardiovascular health issues. So joining us to talk about this, Dr. Troy Pascoe, internal medicine doctor at Bronson Internal Medicine in Battle Creek and director of the Bronson Wound Center and hyperbaric medicine in Battle Creek. How are you?
I'm doing well, Lacey.
That's good to hear. And what are your thoughts about chronic wounds and wound healing associated with heart health? It's not something I would normally think of being connected.
Well, certainly the intersection of chronic wounds and impaired wound healing is typically in the form of PAD or peripheral arterial disease. PAD, however, I like people to think of it as a more systemic disease. Many other folks have heard of CAD or coronary artery disease. Ultimately, both of those disease states are systemic, and that would be atherosclerosis. Many have heard of how plaque builds up in our arteries, and literally that can occur from head to toe, as I say. And certainly the wounds that we treat here are impaired by PAD or impaired blood flow, particularly to the lower extremities. And certainly, as I said, I'd like to think of PAD as a more systemic illness rather than being isolated to the extremities, because we almost always know if PAD is present, coronary artery disease is also present, as I said, being a systemic disease.
And maybe you have some statistics for us about how many people are dealing with cardiovascular disease.
Well, in one way, shape, or form, up to a third of Americans have some form of cardiovascular disease, be that hypertensive heart disease, atherosclerosis, coronary artery disease, or PAD. So it is definitely a very common condition that we see.
And how many people suffer from chronic wounds, and how does a cardiovascular disease hinder wounds from healing?
Between 6 and 7 million folks right now are currently living with a chronic wound. Now, certainly not all of those are as a result directly of PAD, but I would say based on my experience, up to 20 to 30% of those are directly affected by peripheral arterial disease or atherosclerosis. And the way that PAD impairs healing is that when there's reduced blood flow to an area, there's reduced oxygenation of that tissue and nutrition and other factors. And ultimately, that impaired flow leads to reduced healing. We can also see uniquely in diabetics that they get a particular form of arterial disease called small vessel disease. That is, when we think of PAD, we often think of the large arteries that run throughout our body, but we also have very small arterial vessels, and diabetics are particularly prone to blockage of those very small arteries, and that can compound the difficulty that diabetics have with healing.
Now, see, I'm more familiar with hearing about diabetics having trouble with their wounds, so this is all new to me, that having an unhealing wound could also be a sign of heart health issues.
Oh, for sure. And in fact, I often counsel patients when we do identify the presence of arterial disease, that I remind them, as I said before, that this is a systemic disease and that almost certainly they have underlying coronary artery disease. Yeah, diabetics are particularly troublesome, as not only do they lose blood flow in the big vessels, but they also can lose blood flow in the small vessels and oftentimes lose sensation, so they lose those protective senses that make them more prone to form a wound in the first place.
So how do some of these patients get help who are suffering from the chronic wounds?
Well, first and foremost, when we're talking specifically about PAD and healing, oftentimes those patients may be a candidate for angioplasty. I will probably mention mention a little more when we talk about other ways to live a more heart-healthy life. But in addition to angioplasty or referral to a vascular surgeon, we also do have certain medications that we can use, and uniquely, in some cases, particularly in diabetics, we offer hyperbaric therapy. Hyperbaric therapy is basically we place patients inside a chamber that we place 100% oxygen within that chamber, and they're treated at anywhere between 20 and 40 feet of seawater equivalent. I like to use that analogy. When we use atmospheres, I don't think a lot of people can identify with that, but I think a lot of folks can identify with their head being under the water and the pressure there. So, so hyperbaric therapy is uniquely beneficial in those diabetics that have that small vessel disease, which unfortunately there is no way with those very small vessels that we can go in and put a stent or angioplasty. So hyperbaric is uniquely set to address those problems.
What are some tips you can share on how individuals can work toward living a more heart-healthy lifestyle?
Well, first, exercise. Exercise, regular aerobic exercise. I generally recommend anywhere between 15 and 30 minutes, depending on the individual. Smoking tobacco, particularly smoking tobacco puts into the bloodstream carcinogens, carbon monoxide, and I will address that when patients come in that are active smokers. Nicotine replacement therapy, although is not completely risk-free, is a 95% safer alternative than smoking tobacco. Lots of fruits and vegetables, not being overweight, getting good sleep, and I would offer one of my things I'm passionate about is statin use. I know that's become controversial in some facets of the world, especially with Google. I think a lot of people hear bad press about statins, but statin drug therapy, has not only been shown to prevent the formation of atherosclerosis, but in some cases has been even shown to regress plaque. So I am a big proponent of the use of statin therapy for those patients that have high cholesterol, but even some patients that don't have high cholesterol, because we know that statins work in other ways besides lowering cholesterol.
So do individuals need a referral for the wound center here in Bronson?
No referral is necessary. Our number here is 269-245-8560. Now, we prefer, if possible, that patients involve their primary care provider, so certainly a referral from their primary provider is always desirable, but by no means does a patient need that. They can call and make a self-referral if necessary.
Okay, and then real quickly, how can someone learn more about specifically heart and vascular and wound services that are available at Bronson?
Well, they can visit www.bronsonhealth.com. They can certainly, and as I said above, talk to their primary care provider about that. We have wound locations. Now, the number I gave you was to our one on Battle Creek, but we also have locations in Kalamazoo, Paw Paw, and South Haven. So depending on a patient's location, we certainly can provide them with a reasonably close location for them to receive wound care services.
All right, Dr. Troy Pascoe, an internal medicine doctor at Bronson Internal Medicine in Battle Creek and director of the Bronson Wound Center and Hyperbaric Medicine in Battle Creek, we appreciate your time this morning.
Absolutely. You have a great day.
You as well.